Okay, so I have gathered all of my materials. I'm going to verify the 6 rights of medication. So the patient is Bridget Kaiser. The medication is going to be the tuberculin skin test. The dose is going to be 0.1 milliliters. The route is an intradermal injection. The time is 1 time now, and I will be documenting afterward. So now I'm going to calculate the right dose. So the order calls for 0.1 milliliters. On the medication, it's 5 TU per 0.1 milliliters, so I'll only be doing 0.1 milliliters. I'm going to be using a tuberculin syringe with 25 gauge needle and a 5/8 of an inch needle. Okay, so hi, my name is Brittany. I'm going to be your nurse today. I'm going to provide you with some privacy by closing the door. Can you please tell me your first and last name?
Bridget Kaiser.
Okay. And what is your date of birth?
7/8/77.
Okay, you are the right patient. So, do you have any allergies, seasonal medications, food, anything like that?
Nope.
Okay, so today I'm going to be giving you the TB skin test. It's just to see if you have either an active infection with TB or if you've been exposed to TB. What I'm going to do is inject a small amount of the PPD, the fluid, and then into the dermis of your skin, and then later we will inspect the area for a reaction to see if you do or do not have an exposure. So some of the side effects for this: when I inject the syringe, you're going to feel a little bit of stinging or burning. You might have some redness, a little bit of pain, a little bit of itching. But if you have any adverse reactions, please let us know. Some adverse reactions would be crusting or scabbing, or like a big bruise near the area, a hard bleb. If you have a fever, some coughing, lightheadedness, fever, or extra tiredness. Do you have any questions?
I do not.
Okay. So first I'm going to perform hand hygiene with hand sanitizer. Then I'm going to don some gloves, which are clean gloves. Then I'm going to prepare the medication. First, I'm going to clean the top of the vial. I'm going to pull the amount of air that I'm going to be injecting, which is 0.1 milliliters. Okay, it's at 0.1 milliliters. Now I'm going to inject the 0.1 milliliters of air into the syringe or the vial. And I'm going to invert it and pull 0.1 milliliters of fluid into the vial. I have 0.1 milliliters in the vial, and the order calls for 0.1 milliliters, so I've verified the dose. I'm going to make sure there's no air, and it's still at 0.1 milliliters, so it is the correct dose. Now I'm going to I'm going to inspect the area, so it's going to be 3 to 4 finger widths below the antecubital space and a hand width above the wrist. The site has no lesions or skin discoloration. I'm going to palpate for tenderness. Is it tender?
Nope.
Okay, so the site is good to use. Now I'm going to clean the site in a big circle and make sure that it dries before I inject the skin test, and I'm not going to blow on it or anything like that, and I'm going to make sure not to touch the area. So since it is dry, I'm going to take my non-dominant hand and stretch the skin. If I can move my hand, there we go. And then I'm going to, with the bevel up, I'm going to inject at a 5 to 15 degree angle until resistance is still felt. I'm going to slowly inject the medication until I see the white or the bleb. Now I'm going to remove the needle and hold that over it, and I'm not going to recap the needle. I'm not going to massage the area either, and there's no blood, so I'm not going to use a bandage. I'm going to remove my gloves and perform hand hygiene.